Good morning. I am Nikki Soda, the Membership Development Officer with NAATP. And in continuation of Membership Month, we are honored to have BK McDonough here with us. She is the Director of Government Affairs from Caron. Good morning, BK.
Good morning. Thank you so much for having me.
What was your first exposure or experience to the National Association of Addiction Treatment Providers?
It really was as I was coming into government affairs at Caron. I had kind of known about it previously, and here and there I would get a newsletter, but it had not been a prime area of my focus. And then one day, Doug Tiemann, who's the president and CEO of Caron, had said, well, you need to talk to Mark. You should talk to Mark about that. And it was about kind of state level advocacy stuff. I called Marvin, and he was, very courteous and patient with me, and Peter Thomas as well. That was my first interaction and first real awareness of NAATP.
And so Mark Dunn is our Director of Public Policy, for those who don't know, and he is located in Washington, D.C. BK, I understand that you two have a good relationship, and how often do you talk to Mark?
It depends on how many questions I have. So when I try to keep an eye on what's going on legislatively in the Capitol. And when I have a question about something, I just shoot him an email or give him a quick call. And he's very receptive and responsive. A great resource to have. First, I wasn't real clear about a lot of things as far as advocacy for substance use disorder treatment providers. And he's been a good resource.
You participated in National Hill Day last year in Washington, D.C. How was your overall experience with that Hill Day?
Oh, I think it was great. I actually was part of the committee that was putting that together, and I was grateful to be included in that as it moved forward. But I think the Hill Day for NAATP was particularly important because treatment providers need to be seen and heard, not just in their state capitals, but also on Capitol Hill.
What do you see, BK, as you are in the middle of government affairs and public policies, what do you see as the value for NAATP having a director of public policy or their overall advocacy efforts?
I think helping treatment providers, the member organizations, stay up to date on what's going on, because ultimately what's happening in the Capitol is going to filter down and it's going to impact the way that we deliver care. It's going to impact the funding for that care. And, having that voice at that top level is, not just for treatment providers, but also for the patients and their families. We need folks who are, meeting with the patients, that are talking about the standards, that are talking about the outcomes, but that are also talking about what are the struggles of families to access treatment. Right. What are stumbling blocks to folks who are in treatment? What is truly a gold standard of care? Right. And who determines that? Like that, I believe, needs to come from treatment providers.
I completely agree, and I think that Caron is the epitome of an example of what the gold standard of care is, and so who better to be pounding the pavement, so to speak, than you to representing them. So COVID-19 is clearly an issue that is at the forefront of everyone's mind. What issues, BK, are you currently working very diligently on right now? What would you say are the two main issues?
PPE testing, and making sure that, or at least trying to make sure that treatment providers are included high up on that list of folks who need the PPE, and the organizations that need to be able to test patients coming in, especially as a residential treatment provider. When this is not a time to be saying no. Right. This is not a time to be sending people home. This is a time to, we're at the crossroads of two health crises, two declared national health crises. And how are we going to navigate that without the tools that we need, without keeping the patients safe, without keeping our staff safe? So that's one of the top things. The other one I'm really keeping a close eye is telehealth. I'm looking to see how that's going to move forward. In conversations with other treatment providers, I'm hearing that there's increased engagement. Mm-hmm. And from other folks, there's a disconnect, right? And so there's always those people that fall off. And then there's the clients who And the patients who, for outpatient, need that connection. They want to see somebody face to face, and
Sure.
how are we going to do that safely? But as far as the telehealth goes too, are we getting paid equally, right? Is the
Right.
reimbursement equal? We're talking about the same qualifications, right? The same
Right.
level of qualifications for staff. We're talking about the same amount of time for the paperwork. We're talking about the same amount of effort for the billing. And, is that being paid or reimbursed fairly?
Those are two very pressing issues that need a lot of TLC right now. The last question I want to ask you, BK, is for those members who are perhaps hesitant because they don't know much about public policy, what suggestions would you give to them of how to become involved?
I mean, first and easiest is making sure you open the emails from NAATP that have public policy updates. And I think definitely engaging with Mark Dunn. Even for me, and I know that Caron is one of the very few treatment providers that has, the resources available for somebody to be in the role that I'm in. But it would be great if we could, not just have a link to find your legislator, but also here are the top 3 things that you need to say.
Is there anything that you would like to close with what Caron is currently doing or what you could use some support on?
Yeah, I think this continues to be an issue as far as substance use disorder treatment not being seen as like legitimate healthcare. I think there's
Right.
been a lot of progress. So there's 2 things. One is getting treatment providers to the decision-making table, right? Before the legislation is drafted, before the initiatives are implemented, in that development stage, we need to be at the table. And we, not just being Caron, I mean NAATP and any and every member. But then, secondly, we're talking about standards. We're talking about outcomes. And when you look to other areas of healthcare, those exist,
Right.
and we need to have those as treatment providers to be taken seriously, for that funding even to be available to us. And along with that, I would say like the biggest challenges is as we develop standards for care, as we implement standards, as we track the outcomes, I think we need to do that hand in hand with insurance providers.
Yeah.
I don't think it would benefit either side to develop them independently.
I agree.
And I think it sets up an arbitrary relationship, or creates a conflict, and who's right and who's better, and and what should be done. I think we really need to collaborate together and really focus on a value-based system of, for higher quality care, higher reimbursement. And how do we know it's higher quality? Because of the outcomes. Well, what are
Right.
the outcomes?
Right.
And who's making those decisions? And I think that that's a key role that NAATP can play.
I agree, and very much appreciate your insight and your suggestions, BK.
I am especially grateful to be able to contribute to the greater good in this way.
Right.
And I appreciate the support from NAATP and Caron's membership with them as well.
Thank you too for all the work again that you're doing, not just for Caron, but for the community at large and for the industry, because you've been doing this a while and you are a difference maker. So I want to say
Thank
thank you,
you.
and thank you, Caron, for being a longstanding member.